Hello, welcome to ANA community. From the past several days, we were discussing about the nature of history taking, which is considered to be one of the first and foremost step of diagnosis of a disease or Vyadhi Vinishthaya. Today, we are going to have the discussion on the next step of the diagnosis of disease, that is what we can say, that is physical examination, where we are going to have the apart from interaction, we are going to go towards the patient. So we are going to do the examination or the touch the patient by looking in by the hands, so that we are going to identify the probable abnormalities present in the patient as such. This particular examination is of two categories: general examination and systemic examination. The term general examination is the one where we are going to examine the patient before going into the systemic examination proper. That means before the moving towards the patient, just by looking at the faraway distance itself, we can able to identify the probable disease a person is suffering from. These are actually the 5 steps of the diagnosis. First step is case history. Second is physical examination. Third is the collection of all the data pertaining to the patient. Fourth step is selection of relevant data and rejection of irrelevant data. And fifth step is the suggesting the necessary laboratory investigation. As far as the physical examination is concerned, which is the main topic of discussion today, there are two categories: general examination and systemic examination. The term general examination is overall assessment of the individual before commencement of a systemic examination. So that means whenever a person is visiting you, by the door itself, we can able to identify in some of the cases that probably the person may be suffering from the knee joint pain, or the person may be suffering from cerebrovascular accident, or the person may be suffering from bronchial asthma, or the person may be suffering from seizure disorder, like that. So we can able to identify the probable disease is being present in that particular individual. So this requires, in most of the occasions, disrobing of the patient is necessary. But while doing the general examination, disrobing is not usually being done. Disrobing is done only while performing the systemic examination. For example, circumduction gait. When the person is coming to you, by having the circumduction gait, we can able to say that the person is suffering from cerebrovascular accident. Or when the person is having antalgic gait, that means he is giving more stress towards painless limb and less stress on the painful limb, which is indicative of the person may be suffering from either sciatica syndrome, or the person may be suffering from some severe painful knee joint disease, etc. So like that, so general examination will be helpful in probably in assuming the probable disease a person is suffering from. Here we are going to have a little bit few examples. After that, we are time permits, we are going into the systemic examination proper. When you think about the general examination, any part of the body can be analyzed by seeing the eyes, we can able to say whether the person is suffering from jaundice or whether the person is suffering from anemia or any kind of the uh, is the disturbance is related to cornea or lens is being present or not. It can be analyzed by seeing the nose itself, whether the person is suffering from any kind of the respiratory distress can be identified, whether the person is suffering from any kind of the upper respiratory tract obstruction etc. can be identified, or whether the person is having the uh, bronchial asthma features can be identified. If the person is having the breathing through the mouth, nasal obstruction can be predicted. When you are going to see the tongue of the person, whether the person is suffering from any kind of vitamin deficiency, or whether the person is having anemia, or whether the person is having any kind of tongue tie, or whether the person is having the what do you say that the extrapyramidal lesions, etc., that can be very well identified. So, by seeing the joint itself, whether the person is having any while walking itself, whether he is giving more grimacing face while walking, can be identified. So, like that, general examination will be helpful in concentrating upon the probable disease itself. When the person is visiting the OPD of your hospital, just by far away distance itself, you can able to identify the probable illness as such some of the occasions. And when the person is walking towards the room of where you are sitting, at that particular time period, you can able to analyze even much more deeper. When the person is having the interaction with the patient, you can even able to analyze his emotional status and mental status related to the illness as such. So likewise, when the person is doing the general examination, it is helping us in narrowing the systemic examination to be performed in the patient first. For example, when the person is having circumduction gait, you are supposed to do the neurological examination first. Or when the person is having the itching or skin lesions, you have to do the dermatological examination first. When the person is having uh, the hand which is pressing the abdomen, you are supposed to do the per-abdominal examination first. Or when the person is having the breathing discomfort, distress, you are supposed to do the respiratory or cardiac examination first. Like that, so we can able to identify the probable system should be examined first by doing the general examination itself. In this particular image, suppose if the lady is having the what do you say that the hand on the knee joint, so it indicates probably she may be having the affliction of left knee joint. So that means the clinician has to concentrate on examination of left knee joint. See, in this particular example, if the lady is having the discoloration of the skin, then it indicates that the initial examination should be related to dermatological illness. Or if the lady is having the pain, the rashes on the either sides of the nose, the probable diagnosis may be moving towards systemic lupus erythematosus, or otherwise it is being in short form, it is being said that SLE. When you are going to do the examination of the nails, suppose in this particular example, the lady is having applied the oil. So that means it is by seeing that we can see the oiliness of the skin. When you think about the nail, you have to see the bluish discoloration of the nail, which may indicate that you are supposed to concentrate on the cardiac disease as well as respiratory disease. When the person is having the swelling of the distal phalanx, which is being said that clubbing, you are supposed to do the examination of a respiratory system and cardiovascular system first. And when you are seeing the Bewes lines, which is considered as the transverse depression seen in the nails, that indicates that he is suffering from some kind of the nutrition deficiency disorder. In this way, so the general examination helps us in narrowing the probable diagnosis of the disease as such. Thus, take-home messages from today's discussion are: general examination has to be performed prior to systemic examination. The reason is, in case of doing the general examination, first and foremost thing, disturbing of the patient is not required. And by doing the general examination, we will be coming to a conclusion what might be the probable disease the person may be suffering from. Wherein the general examination starts along with the history taking itself, whereas systemic examination commences after the history taking itself. So, general examination gives us the avenue, concentrate the physical examination to be performed. That is, which examination of a system has to be performed first, we will be in a better position to understand. For example, presence of cough indicates that respiratory system or cardiovascular system has to be done first, whereas the person is suffering from loss of strength in the left upper limb and lower limb. Initial examination should concentrate upon central nervous system. If the person is suffering from the itching and skin lesions, initial examination should concentrate upon the dermatological examination. Dear ANI community members, that's all for today. What are the major key takeaways from today's discussion on general examination and its significance? Mention in the comment box below. And what is the one topic that you'd like to hear in this community channel? Mention in the comment box below. And if you are liking this particular video, then put a thumbs up and spread this particular video to maximum number of true Ayurveda learners, okay, so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.